Hey, Dr. Hagmeyer here, and today I wanted to shoot today's video because I'm seeing an alarming number of patients who have SIBO and IBS come back with major nutritional deficiencies in some of the most common and critical vitamins and minerals and amino acids and fats that are really needed to heal and seal the gut. I'm also seeing an alarming number of problems with the metabolism of these amino acids that potentially could be one of the causes, if not the sole cause, behind things like depression and anxiety, sleeping problems, and brain fog that we often see go hand in hand with people that suffer with these GI issues. So if you struggle with GI issues, IBS, SIBO, leaky gut, Crohn's, colitis, or really any other kind of GI problem, you've probably been so worried about the symptoms of stomach pain and constipation and diarrhea and bloating that you haven't given much thought into some of the nutritional deficiencies that almost always exist in your body and how those nutritional deficiencies are really preventing your body from healing. Now, I'll say that another way. We become so hyper-focused on the symptoms and the crisis that we're in that we've forgotten about the underlying root causes of how we got into that mess in the first place. Almost every single day I get a phone call from men and women, young adults and parents who are literally in tears. They've gone gluten-free, they've gone dairy-free, they've gone sugar-free, they've gone fructose-free, they've given up on all sweets, they've given up on smoking, they've given up on drinking alcohol and drinking soda. They started working out and they're only drinking kombucha and they're making their own fermented foods at home. And their intestines are still inflamed and they're still having all of these problems. And they don't understand why they still feel so sick. And so if that's you, you really need to watch today's video because it's going to be packed with information that will help you understand how critical these various vitamins are to the healing of your gut. And if you know anything about my practice philosophy, maybe you've watched some past videos that I've done, then you know that I believe that you need to look at the big picture when it comes to GI issues and when we suffer with these chronic health problems. And the key to understanding here is that everybody's big picture is different. And so if you look at this illustration here that you see, you're going to notice that diet is not the only reason why you're sick, right? Diet is only one piece of a much bigger puzzle. And so you're not going to get better by simply taking a probiotic and a digestive enzyme and drinking bone broth all day long and growing and fermenting your own foods and eating them several times a day, right? There may be important things to your healing journey, but the reason why many of you are still struggling out there and not getting any better is that you're missing some of the other bigger pieces of the puzzle, all right? In some people, the other pieces may be infections. They may be inflammatory conditions. They may be pancreatic malabsorption, okay, or pancreatic insufficiency. They may be bile acid insufficiency or malabsorption of these bile acids. In others, it may be things like sex hormone imbalances that are contributing to our GI issues, especially if you're a woman and you notice that there's problems with your GI system right around the end of your menstrual cycle, all right? Maybe there's thyroid problems, or maybe you've just been under a lot of stress. Maybe in others, there's food sensitivities and food allergies and things like leaky gut and excess histamine from those fermented foods that you're eating on a daily basis. Maybe some of you have autoimmune diseases that are playing into this big picture. Okay, maybe all of these things that you see here lying under this iceberg here, these are the pieces of your individual health struggle, and they vary from person to person to person. But in all cases, no matter what your diagnosis is, these vitamin deficiencies are the common thread, they're the common denominator that we see amongst all patients that suffer with GI issues. And that's the puzzle piece that I want to talk to you about in today's video. Like I said, this is foundational healing, right? Anytime you start to address these foundational issues in nutritional imbalances, this is foundational. And unfortunately, all too often, this gets overlooked for the more exciting things like probiotics and digestive enzymes and so forth, all right? So in today's video, you're going to learn a lot more about these nutritional deficiencies and the specific vitamins, what they do, and why they're so important. All right. In another video that you'll see, I talk about various amino acids and the role that these amino acids play and how problems in the metabolism or the breakdown of these amino acids lead to a lot of the things like depression, anxiety, and sleeping issues. And there'll also be another video that you can go back and watch that talks about the importance of the fats that we eat and the kind of fats that we eat. Okay, these are all very, very important, again, foundational issues. So let's get into today's video. Let's unpack some of the most common nutritional deficiencies and why they exist, and again, of course, why they're so important. All right, so number one is your B vitamins, right? Now, there are actually 8 B vitamins, and they're all essential for digestive health in one way or another. And since they're water soluble, our B vitamins are the water soluble vitamins, all right? That means we can't store them in our fat cells or the tissues of our body. So therefore, we have to have a regular supply of them from either from our diet or from taking supplements, like a dietary supplement. B vitamins are incredibly important for digestion, all right? In general, they help move energy obtained from the food into the tissues and cells where it's needed. In particular, B vitamin 1, or thiamine, helps convert the carbs in our diet into energy. This fuels your cellular metabolism, it helps regulate your appetite, and if you think about it, how many people feel run down and they feel tired, they have brain fog, they can't mentally process things, they can't stay focused on a task? Sometimes this is due to a B deficiency, and specifically, sometimes it's a B1 deficiency. The next very important B vitamin we want to talk about is riboflavin. Now, riboflavin, or B2, is actually very important because it helps keep the mucosal lining of the digestive tract healthy, right? It also helps break down proteins and fats and carbohydrates in the foods we eat. And without vitamin B2, you can have trouble digesting food and converting that food, again, into energy. The other thing is about B2 is that it must be present in high enough amounts in order for the body to allow other B vitamins like B6 and folic acid to properly do their jobs. And B6 deficiency can be one of the causes of that as well. We see B6 deficiencies in things like mental health issues. We see it in problems with anxiety. And again, B2 is needed to make some of these other B vitamins work the way they're supposed to work, right? So again, it's a family of different kinds of B1, B2, B3, B4, B5, B6, and etc. And the important thing to understand is that one of the things about B2 that I think is a common symptom is problems where we develop mouth sores, okay, or swelling of the tongue. These can be signs that there's a B2 deficiency. Now, according to the USDA, vitamin B2 or riboflavin deficiency is not very common in Western developed nations, most likely because many of the refined carbohydrates that we're eating are fortified with riboflavin. If you look at all the cereals that many people eat, they eat these foods that say fortified or enriched. But if you're a person who has malabsorption, or maybe you're a person who has leaky gut, or maybe you've eliminated grains because you have non-celiac gluten sensitivity, or you have celiac disease, then this could be a very serious deficiency. Many people, unfortunately, because their body is so reactive to so many different kinds of foods, they wind up eating, very few foods in the entire spectrum of the foods that they should be eating. And this also creates these vitamin deficiencies. Another vitamin that's very important is vitamin B6. In vitamin B6 deficiency, this is often a problem that I see in patients who not only have things like anxiety and depression, but those patients who also have GI problems, okay? B6, otherwise known as P5P, it protects the body, it protects the gut, and one of the reasons why B6 is so important is that it helps combat the dangerous levels of inflammation and homocysteine. Now, I've talked all about homocysteine in a lot of other videos that I've done, but B6 is one of those vitamins that researchers have found that people who have the lowest levels of vitamin B6 in their blood, they have the highest levels of chronic inflammation. And those with the most amount of B6 circulating in the bloodstream had the least amount of inflammation. And again, I've seen it over and over how valuable B vitamin is to many patients with anxiety and depression. Several studies have also shown that low vitamin B6 status is associated with things like rheumatoid arthritis. It's associated with chronic inflammatory bowel diseases, both of which, again, have an underlying chronic inflammatory component to them. And again, B6 is one of those vitamins that I also think is so important for people who find themselves suffering with symptoms of excess glutamate. All right, there's a video that I did that talks about all about anxiety and depression, and I go into a lot of detail about glutamate. But the symptoms of excess glutamate are things like headaches, they're things like seizures, things like depression, things like ADHD, feeling restless. Maybe you lay down in bed at night and you just can't sit still. Your legs are constantly moving, your arms are constantly going. Also, one of the things we see with excess glutamate is increased pain. Also, we see that with fibromyalgia too, don't we? So again, B6 is another important vitamin because it activates the conversion of glutamate into GABA, right? And glutamate is an excitatory neurotransmitter, and GABA is a calming neurotransmitter. So if you have low levels of B6, that glutamate will not get converted, and you'll be stuck in this excitatory state where you have too much glutamate. Most people who have IBS or have SIBO can relate to that, right? They have anxiety, they have depression, they have trouble focusing and concentrating, and they feel tense many times. Maybe they feel like their stomach is constantly in a state of spasm. So again, consider these things that we're talking about. Now, another B vitamin that people who suffer with IBS and SIBO and inflammatory bowel disease often suffer with from a deficiency state is biotin, right? Biotin is also known as B7, and when you think of biotin or you think of B7, I want you to think about your hair, your skin, your nails. I want you to think about the benefits of biotin in that it helps stimulate hair growth, and it causes hair growth to thicken and helps your hair look beautiful, right? If you're a person who has struggled with GI problems, then you know, especially if you've been struggling with them for years, you know how sick and unhealthy perhaps your hair is or your skin, right? And this can, again, all be related to gut health. So again, strong correlation between gut malabsorption, nutritional deficiencies, and other problems in the body like we're talking about here. Now again, biotin can also help hair look healthy while growing more quickly. And of course, that becomes important because healthy digestive systems absorb biotin from a healthy diet, right? And so those of you who suffer with digestive disorders can absorb these nutrients, and we become increasingly nutrient deficient, all right? Now, Crohn's disease, people with Crohn's disease often require elevated nutrient levels in order to receive the vitamins and minerals they need to stay healthy. If you think about this, if we're a person who has an inflammatory bowel disease where we have lots of diarrhea, we're losing these B vitamins very, very quickly, right? And so again, other symptoms of a biotin deficiency, again, unfortunately, are those things like depression and fatigue, all right? Tingling in the arms and in the legs. There's been some studies that talk about those people who are cigarette smokers and how if you're a cigarette smoker, there's an evidence that cigarette smoking can actually cause a biotin deficiency. And so, you know, if you're a smoker and you have unhealthy hair, that could be, again, potentially one of the reasons, right? All right, now the next thing we want to talk about is a folate deficiency. This is, again, another common vitamin deficiency that plays an important role in gut health. And the bacteria in the gut, specifically the lactobacilli species and the bifidobacteria species, are two of the most important families of good gut bacteria that populate our gut microbiome. And it turns out that these bacteria, and specifically Lactobacillus plantarum, are responsible for producing many of the B vitamins, including folate. So again, something to consider if you're having these gut issues, and let's say you have a test that shows that you have low levels of lactobacillus. This again may be one of the reasons why you're ending up with all of these B vitamin deficiencies. Unfortunately, blood testing for folate deficiency is almost always useless, right? And so when it does show up as a dietary deficiency, you really have a very major deficiency at hand. Folate and folic acid work with vitamins B6, they work with vitamins B12, and again, these are the nutrients that help control the blood levels of the amino acid called homocysteine. High levels of homocysteine, like we talked about earlier, are associated with things like heart disease and inflammatory conditions. We talked about them as they relate to inflammatory bowel conditions and rheumatoid arthritis, right? So again, that's one of the markers that sometimes I tell patients it's very important that they get that test run, all right? Other markers that I think are very important that I put a lot of faith in, again, include things like homocysteine, methylmalonic acid, or MMA, and a test for a gene mutation called the MTHFR gene. If you have elevated levels of homocysteine, but your MMA levels are normal, this typically indicates a folate deficiency, all right? So that's a much better test than simply just looking at folate. If your homocysteine levels and your MMA levels, if these are both elevated, this is more typical of a B12 deficiency. So again, some things you can look at if you've had these tests done. So in the chance that you've had these tests done, I put this on this video just for you to see it. Now, another way that I like to evaluate folate deficiency is a test known as formiminoglutamate, or FIGLU marker for short. And this marker, combined with homocysteine and combined with MMA levels, can be very, very important in understanding whether or not we're dealing with B6 or B12 deficiencies or folate deficiencies. Okay? If you're a person with celiac disease and Crohn's disease or other gut markers indicating that there's inflammation, ask your doctor to run those tests. Get that homocysteine test done. Get that MMA marker, because that MMA marker is actually even more specific to a B12 deficiency than B12 alone. Okay? Sometimes I run both, but that MMA marker is very, very specific to a B12 deficiency. Again, homocysteine is a marker of vascular inflammation, and we often see this elevated in many GI patients. And so again, if you do have had this test done, you'll notice that the range, I think it goes up to 15, all right? You want to make sure that your levels are above 7, but not that much higher than 7. So around 6 to 7 is where you want to see them. Anything above 7 is considered a problem, all right? So it's a kind of a tight range that you want to see. Maybe even 5 to 7 would be okay, but anything 8, 9, 10, 11, 12, 13, 14, 15, this is where problems really start underway. And again, if your levels are as high as 13, 12, 13, 14, 15, okay? What's happening here is your brain and the nerves of your body are being bathed in toxins, all right? And this is not a good thing. Patients who have diarrhea, as in the case of inflammatory bowel diseases, or patients who have hydrogen-dominant SIBO, these water-soluble vitamins are going right through you and you're becoming increasingly deficient. And again, that could be the correlation between some of the symptoms that you're having and the problems that we're talking about today. I recommend everyone, at a minimum, take a high-quality B supplement, and if possible, best case scenario is get testing that can, of course, more precisely evaluate your nutritional deficiency status. All right, so we talked about a lot of the different B vitamins that we often see. The next one we want to talk about is iron deficiency. All right, iron deficiency anemia is another common problem. This occurs frequently in people who have SIBO and Crohn's disease and ulcerative colitis. It's also commonly found in patients with H. pylori and even non-celiac gluten sensitivity. Bacteria can damage the mucosal lining and they can damage the tight junctions, and these toxins, or the increase in the gut permeability, can further exacerbate the absorption rates of iron. So the good news is that testing for this marker, this biomarker, is very easy. Any test, any lab can do it, and really there are a couple biomarkers that you really need to have done. All right, these 6 biomarkers would be things like your serum iron levels, your hemoglobin levels, your hematocrit levels, ferritin levels, total iron binding capacity, and iron saturation. Okay, these are the markers that you want to have done, especially if you're experiencing things like fatigue and brain fog. All right, again, this test is so easy to have done. I can't think of a single good reason why you shouldn't have it done, and it's become a routine blood test that when I work with patients who have these kinds of symptoms, or really any kind of GI problems, that I want to actually test them for. Okay? One thing I want to stress is that while identifying this iron deficiency is important, even more important is understanding, again, why that iron deficiency exists. Okay? Iron anemia is usually coming from a few different places, and these are the things that I want you to be aware of. Of course, it could be coming from a dietary deficiency, as in the case of people who are vegetarians and vegans. It could be coming from injury or an infection or an inflammation in the intestinal lining, or it could be caused by internal bleeding. Maybe you're a woman and you have heavy menstrual cycles, or you have fibroids, or you have endometriosis, or maybe you have stomach ulcers, or perhaps you even have hemorrhoids on a regular basis. These are all reasons that would potentially explain why your ferritin levels are so low and why your iron levels may be low. So again, something to consider. Now, anytime we injure the mucosal lining, we create oxidative stress, and we create free radicals, and we create cellular damage. And this can, among many things, impair iron absorption as well. And so if you have iron deficiency, and but you eat red meat, or you eat seafood, or you take a multivitamin, the problem isn't the fact that you're not getting the right amount of iron. It's not too little iron. It's probably bad absorption. So you have to take a look at what you're eating. In this case, adding more iron to a body that can't absorb iron will not help your iron status. In fact, if you do that, it could cause more stomach pain because it could feed some of the microbes in your gut, and of course it also could help create biofilms, right? So you may have heard that eating more spinach and green leafy vegetables is the answer to correcting these iron deficiency states. And while many plants are high in iron, the fact of the matter is some contain iron absorption inhibitors, things like phytates and polyphenols and oxalates, and these can, unfortunately, these can impact iron absorption or bind up the non-heme iron component in the digestive tract, okay? Also, the iron found in plants and milk and eggs, these are what we call non-heme iron. These just don't get absorbed as well in the body as does the iron that's found in organ meats and found in red meat. So one of the other things I want to point out here is that if you are iron deficient and you are drinking green tea, you may want to stop for all the reasons that I just mentioned earlier, right? So again, before I leave the topic of iron deficiency, if you are iron deficient, number one is taking iron and you are experiencing abdominal pain, you probably have a malabsorption issue on your hands, and so it becomes super important to, again, understand and find out the cause of that malabsorption. Number two is eat more red meat or liver or other sources of heme iron. Number three, take vitamin C, lactoferrin, and avoid foods that are high in phytates, oxalates, and polyphenols. By doing all of these things, there shouldn't be any reason why in a few months, perhaps depending on where your levels are, even in a few weeks, that these levels come up and now you start feeling better, right? So another common deficiency that we often see in patients is a zinc deficiency. Studies are confirming that zinc deficiency alters the makeup of the bacteria found in our intestines. But that's not all zinc does. The recent literature actually shows that zinc alters and influences the leakiness or the permeability within the gut, and that's the gut barrier, right? This is what we call a leaky gut. Now, in past videos and several different articles that I've done in the past, I've talked a lot about a leaky gut and how researchers are actually calling this the biological door into autoimmunity, autoimmune diseases, and even cancer. So again, zinc is very, very important. The other thing is we know that a leaky gut has been shown in many diseases, including things like depression and diabetes and obesity and asthma, and even things like skin conditions like psoriasis and eczema. We also know that leaky gut's associated with things like thyroid disease and heart disease. If you take a look at this diagram that came from the World Journal of Gastrointestinal Pathophysiology here, you can see that a zinc deficiency is caused by things like proton pump inhibitors, right? How many patients out there, you guys who are watching this video, have been on proton pump inhibitors, right? And the thing here is that these medications are known to affect our zinc levels. We also know that low dietary intake of zinc because we're eating a diet that's high in phytates, grains and beans and lentils. Sometimes these are the things that also are inducing these nutritional deficiency states, right? So again, a deficiency in zinc compromises the gut barrier. And when you compromise that gut barrier, you're going to end up with things like food allergies. You're going to end up, again, with malabsorption. You're going to end up with SIBO. You may end up with things like celiac disease and, of course, diarrhea, and even in some cases, according to several studies, even GI cancers, right? So studies have also found that even a mild and even a temporary zinc deficiency can impair digestion, and without any of the typical symptoms such as skin problems and fatigue that we typically do associate with a zinc deficiency. Now, let's kind of talk also about vitamin A, because this is another vitamin deficiency that's often found in people with gastrointestinal diseases. Now again, vitamin A, along with vitamin D and vitamin E and vitamin K, these all belong to a category of vitamins called fat-soluble vitamins. So earlier we talked about B vitamins, and that's a water-soluble vitamins, but your vitamins A, D, E, and K, these are your fat-soluble vitamins, okay? These vitamins play a crucial role and just so critical in our immune system tolerance, right? How our body reacts to the environment and all the things that our immune system is constantly having to determine whether or not it should attack that invader or leave it alone, right? Vitamin A just has a profound impact on the gut mucosal and the immune barriers. I've seen just huge differences in patients who've benefited from supplementing with vitamin A when they're deficient in this area. It's been said that many researchers will often say that vitamin D and vitamin A are essential co-partners, and often when there's a deficiency in one, there's also a deficiency in another. But vitamin D and vitamin A really work together, and that's the important thing. They help stabilize the immune system. They protect our body against pathogens, which are disease-causing germs, right? And without immune tolerance, we have a complete breakdown in our mucosal barriers, right? The mucosal barrier is where just a major part of our immune system hangs out. And so, in fact, just this last week, I've had several patients that I've talked to that have very severe cases where there's been a loss in immunological tolerance, right? These are people that react to the environmental chemicals, you know, the perfumes, the soaps, the detergents, the lotions. Every day there's a new food that they can't eat because their immune system is reacting adversely to it. These are the people who go past the perfume counter and they get headaches and they get dizzy and they get brain fog, or the smell of certain things even causes them to break out in rashes and their skin erupts to maybe different fabrics that they may wash their clothes in. So without immune tolerance, we develop a shift in the balance of our immune system, and this leads to a host of different kinds of autoimmune diseases based on that individual's genetic susceptibility, all right? So again, vitamin A is just fundamentally important because it helps with energy homeostasis, right? It helps maintain the levels of energy within our bodies, all right? New research has actually shown that retinol is essential for the metabolic fitness of the little organelles in our body that make energy. These are our mitochondria. And so again, if you're one of those people who suffers with fatigue and brain fog, and you know, from the minute you wake up in the morning, you're just feeling exhausted, well, again, there could be a vitamin A deficiency. And again, within the cells of our body, these mitochondria, these powerhouses, are dependent on vitamin A. Without that vitamin A, without that retinol, we can't make ATP. So again, this is why vitamin A is so important. So another vitamin deficiency seen in people with gastrointestinal diseases, of course, is vitamin D, right? Today's video would not be complete without talking about the importance of vitamin D. And many studies, if you look at this one here, I'm going to show you in just a moment, many studies link low levels of vitamin D with a higher risk of colon cancer, right? Not only does low vitamin D increase your risk of many types of cancer, but a deficiency also increases, as you can see here, your overall death rate. And that's huge, right? We now know that men and women who live further away from the equator in latitudes where the sun is weaker, right, they develop irritable bowel syndrome and inflammatory bowel diseases much more frequently. We also know that vitamin D plays a major role in taming inflammation and in regulating the immune system, and specifically what are called our T regulatory cells. And this has been very important for those of you that are out there that suffer with autoimmune diseases, right? So it only makes sense that people who have Crohn's disease and ulcerative colitis, both inflammatory bowel problems, would benefit from optimizing their vitamin D levels. The cells, again, along the mucosal surfaces of our intestines are constantly in contact with the foods we eat and microbes and toxins. These mucosal barriers in our nose and in the vaginal tract, our urinary tract, again, are loaded with these immune system cells, and these cells are constantly having to make this immunological decision every single moment, right? Every breath we take, the immune system has to react and determine and decide whether or not the thing that it's coming in contact with is a friend or a foe. And again, that comes back to immune tolerance. So again, immune tolerance is the essence of good health. Strong, robust immune system is dependent upon that immune tolerance. And again, without immune tolerance, our bodies lose their ability to detect that friend or foe. So again, like I mentioned earlier, without immune tolerance, our immune system may hyper-react to the foods we once previously ate without problem, right? How many patients out there watching this video were able to eat, let's say, an apple today or a piece of chicken today, only to find out that tomorrow or next week they're suffering terribly with abdominal pain, right? So this is, again, comes back to immune tolerance. And we're starting to hear more and more about that, all right? So in wrapping up today's video, we learned about the different kind of vitamins and minerals that people with gastrointestinal disease often suffer with and the supplements that I recommend. If you suffer with a leaky gut and SIBO and IBS, H. pylori, it's best to get functional testing done in these areas so that you know specifically what you're deficient in and also what degree you're deficient in those, right? Don't give up. Even if your doctors have told you that everything is normal, right? Chances are they don't practice functional medicine, nor have they really investigated the nutritional piece of your health puzzle, right? If you're not familiar with functional medicine, if you're watching this on YouTube, visit my website. Watch a video that I did that's titled Dr. Hagmeyer Explains Functional Medicine. So there you go. That's going to wrap up today's video. I hope you enjoyed today's video, and I hope you learned a few things. I know we talked a lot of different kinds of vitamins and minerals, but hopefully these are the things, these are the pieces of the puzzle that, again, are the finer points that we often overlook. And again, I hope these are the things that you can take away and implement into your health and your strategy and your journey so that you ultimately have improved and better health. All right? So until next time, take care.